Good morning, everyone. It's Lisa coming on live on our new Tongue Tie Experts Instagram page. So if you've been following me for a long time as Tongue Tie Experts, you'll know that I asked you to move over to this page because my other account, Tongue Tie Experts, got hacked. So now we're Tongue Tie Experts Podcast for now, while we can play with that. Trying to get that back still. But for now, thank you. I am so appreciative for everyone who has followed me on my new Tongue Tie Experts Podcast Instagram account. So today I'm coming on to talk to you about how do we know if releasing a tongue tie is actually going to help with breastfeeding problems. I get asked this all the time, and I'm going to try and answer it for you as much as I can, okay? So how do we know? This is one of the most complex questions, and honestly, a dilemma, is when a parent asks me if they should have their infant's tongue tie released, and that procedure is known as frenotomy or frenectomy, depending on who you ask. They want to know if it will be worth it, if it will solve the problems, if it's really going to make a difference for their infant. And these are great and necessary questions. Sometimes I wish I had a crystal ball and I could see into the future and let these families know for sure. But over the years, I have become better at discerning which infants will benefit the most. And I share this information a lot. We delve really deeply into this in my pro course, The Professional's Guide to Tongue Tying the Breastfeeding Infant. But today I will give you 4 aspects to consider beyond the typical assessment checklist. So this is what I use to evaluate the families that come to my office and make recommendations based on what I'm observing and assessing. Number 1, you want to be sure that there is a tongue or lip tie. Every baby has a frenum, but not every frenum is restricted. A visit to a pediatric dentist or other provider who can perform the surgery to release the frenum is not typically the best evaluation for knowing if there is a tongue or a lip tie. Now, of course, there are exceptions, but most medical providers are not performing a functional evaluation of the breastfeeding dyad, right? So the parent who's breastfeeding or the baby together or the baby and mother separately. Usually it's just the baby being looked at, right? They look in the mouth and ask them questions, but you really need a functional assessment to make sure that there is a tie. Because you want to know that the restriction or the frenum or tie is causing problems with the movements that are affecting breastfeeding, right? And an IBCLC is usually the best professional to see regarding this. Sometimes an SLP is helpful with babies with complex sucking challenges, and I refer to SLPs often, but especially if they're bottle fed, right? So if you're a professional taking care of families who are wondering about tongue tie release and you're not an IBCLC, if it's a breastfeeding family, recommend to breastfeeding an IBCLC. If it's a strictly bottle feeding family, I usually would say go straight to the SLP or speech language pathologist. But either of those professionals can do a thorough assessment of the muscles of the face and the oral motor system that needs to work in order for breastfeeding to happen. So number 2, we want to determine, so these are the 4 aspects that I consider when I'm trying to guide a family about whether releasing the tie will solve their breastfeeding problems. Okay, so number 1 was be sure there is a tie. Number 2 is determine if there are other problems or reasons or situations that might be interfering with breastfeeding success. Now, this can be complicated, and I can do a whole episode on other reasons for breastfeeding challenges or reasons for breastfeeding challenges in general. But for now, I'll list a few for you. One is low milk supply, parent depression or exhaustion, maternal anatomy, infant anatomy beyond the mouth, parent recovering from a C-section or difficult labor, a traumatic birth, separation at birth, such as a NICU admission, or a maternal health concern. Also a need for supplementing bottles, which sometimes there's a need, but that can interfere with breastfeeding success. Something I see often is lack of experience or support in understanding how to breastfeed. This can include how to hold a baby for best latch, how often to feed a baby, how to recognize feeding cues. Any of these complex situations can interfere with the initiation and continuation of breastfeeding, and if possible, should be addressed before considering frenotomy. Because if we release the tongue tie and we don't take into consideration those other situations, we will not have successful breastfeeding, or things will not get better. So number 3 on the items I consider when advising a family if having a frenotomy will help their breastfeeding is that the parents are prepared for frenotomy. This includes knowing what the procedure will be like, practicing exercises and stretches before the procedure, having a plan in place for pain management if the infant seems uncomfortable, and having a written care plan for the night of the frenotomy, the days and weeks following. This is not something to do and ask later, now what? Or have it done when you don't have the time to devote to aftercare. The aftercare, the stretches, the exercises, in many cases are just as important as the procedure itself. So instead of, if you are a professional interested in learning the protocols that ensure your patients will be prepared for the frenotomy procedure, you should check out the Professional's Guide to Tongue Tying the Breastfeeding Infant. It's all included there, including handouts for your patients. If you want, you could find that at tonguetieexperts.net/professional course. Okay, so that's 3. I promised 4. I'm trying to get through this fast for you. The infant is being treated with a team approach. That ensures better success in my experience and the experience of those I network with. We know that, a team approach is important. Now, is this baseball? For those who know me, you know that I'm a baseball freak. Diehard Mets fan. Don't hold it against me. Holding out all hope for this year. But this isn't baseball, but it's still a team approach. This is a medical procedure that requires a holistic assessment and recovery plan. Who is on the tongue tie team? My A team. My ideal recommendation for breastfeeding infants is an IBCLC, as I said, possibly an SLP, a body worker, a provider for frenotomy, and then rinse and repeat until you are on the way to reaching your goals. Quick definitions here. Who are body workers? Body workers are many types of professionals, can include chiropractors, osteopaths, physical therapists, occupational therapists, massage therapists, CST providers, etc. And who are the medical providers for frenotomy? That may depend on your location, but in general, most often it's a pediatric dentist. There are some ENTs who are well-versed in this procedure for infants. There are some general pediatricians. There are some nurse practitioners, advanced nurse practitioners who can do the procedure, but most likely the best trained will be the pediatric dentist, and I hope I'm not offending anyone in that. Just a generality, not trying to diss anyone. Okay, so for more information on that topic, Season 1, Episode 2 is dedicated to the team approach. So check out the Tongue Tie Experts podcast, and you can find that if you're not listening to the podcast now, you can find the Tongue Tie Experts podcast on Apple, Spotify, Google, or wherever you listen to podcasts. And it's Season 1, Episode 2 about the team approach. So whether you're a parent deciding for your own baby or a tongue-tie team member guiding the decision for frenotomy or frenotomy timing with the families who come to you for guidance. I hope that the 4 considerations that I listed here provide insight. Tripping over my words today. Provide insight. Frenotomy is not a procedure to rush into, and we all want the most successful outcomes for our families and for the patients in our care. So if you are looking for more information on the parent side, the link for our Parents Guide to Tongue Tie is below. You can always use podcast 15 to save 15%. And that's a complete guide to get you through assessment, through the procedure, and the aftercare. If you are a professional, now is the best time to sign up for our Professional's Guide to Tongue Tie in the Breastfeeding Infant. Our annual summer sale is going on now. The link is in the notes, but it's www.tonguetie.net/professional course. The course is multidisciplinary. You can join if you are any professional who fits on the tongue tie team. The course provides 4 LCerps for lactation consultants and membership in a community for continued support, learning, and networking. Again, apply at tonguetieexperts.net/professional course. If you're listening to this on the podcast, the clickable link is in the show notes. On Instagram, it will be in my bio. And just remember that the half price sale is the summer sale. So it's half price now for professionals. It's a great time to join. And I hope to see you in the group. Okay, if you're on Instagram with me right now and you have any questions, feel free to ask me. I have a few minutes before my bell is going to ring in a minute. My patients are going to be here. So just pop on your questions. Thanks for listening to me. Again, thanks for being here. I love that so many of you have followed me over from the Tongue Tie Experts hacked Instagram account. I will be adding lots more material and more info and more reels and posts and bringing over my old information to here. And if you're new to following me, thank you for being here. I don't know if I introduced myself in the beginning. I'm Lisa Paladino. I'm a lactation consultant and a certified nurse midwife in Staten Island, New York. And I'm chatting with you from my office today. I'm a little backwards, right? I introduced myself at the end. It's been one of those weeks. You know, having my Instagram account hacked really threw me for a loop. But I am renewed knowing that so many of you are here still and have found me again. And you know what? The good guys win. When I'm not going to let this get me down. I'll get right back up to 10,000 again with your help, right? And what else did I want to tell you? If you don't listen to the Tongue Tie Experts podcast, we've got a fantastic episode this week. Robin Walsh, who's an SLP, COM, and lots more initials after her name, is interviewed on the podcast. I highly recommend that. And we have lots of great episodes over there. And if you love the podcast, please rate it and give a review, because that helps other people hear it and more people will learn about tongue tie from the podcast. So I see a question. I've been told my baby's tie is too vascular to treat. That's interesting. I would get a second opinion. If you don't mind me asking what type of provider told you it was too vascular, because actually a tie doesn't have any blood vessels, which is what makes something vascular. So if you feel comfortable telling me that, I'll wait for your answer. And also, is it a pediatric dentist? Is it someone who has a laser and will be treating with a laser? Because that's depending on where you are. A hospital in England. Okay. All right. So what I don't know a lot. I know I have a lot of followers from Great Britain, And I don't know a lot about the way the system works. However, I have heard that in order to get proper treatment for tongue tie in your country, you often have to go out of the system. So I would look into that. I would say if you come on over to the Facebook group, if you're on Facebook, it's called Breastfeeding Tongue-Tied Babies. There are some providers from England there, and we can network better there to find you the help you need. Okay, I hope that helps. It also depends, England is a big place. It depends on where you are, but I'd love to be able to help you get your help. My parents' course might help you with guidelines, even if you do get someone to help you with the release, but also making sure that that's what's the problem, right? So you want to have a complete IBCLC or lactation consultant evaluation, and I hope you've had that first. And if you're not on Facebook and you don't want to be, you can direct message me at First Time Mummy, and I'll see if I can connect you with someone from Great Britain. Hope that helps. Any other questions before I sign off? My doorbell is about to ring in my office with my first clients today. So I'm going to sign off for now. I'll be back, and like I said, I'll be posting lots of things. Another question. Okay. Sorry that I need my glasses for these questions. KTN23. Will my son just figure out how to latch properly? He has his tie removed. No. A baby doesn't automatically figure out how to latch properly. You need the guidance of a lactation consultant if you're still having continued problems, right? And you need to, just because his tie is released doesn't mean that, so it holds the tongue in place. Now the tongue is free, and a baby needs to learn how to use that tongue all over again. So there are exercises to do. If you want to check out the parents course, there's a whole section on exercises to do post-frenotomy, but definitely a lactation consultant will be helpful to you. All right, I hope that helps. I'll see you again soon. Follow me, listen to the podcast. There's lots of information that will answer your questions on the podcast. So go to Tongue Tie Experts Podcast. You will find, it's on Apple, it's on Spotify, it's on Google. The link is in my bio as well. And you'll find lots of episodes, KTN, that might help you with guiding what's going on. There's also lots of stories from other parents who've been through this, and listening to their stories may help you know what help you need, and also feel like you're not the only one going through this. Hope that helps. Have a great day. Take care, everyone.